Welcome to Mathari Hospital. I am Dr. Olando Milcah, a consultant psychiatrist, and I want us to talk about neurodevelopmental disorders, which simply refers to illnesses or conditions that interfere with the brain functions of a child, leading to psychological strains. Um, the reason why we look at these childhood illnesses is because studies show that when adults prevalence of mental illness is around 8 to 10%, then for children it's usually slightly higher. It can go even up to 12%, meaning children also suffer mental illness, but they are disadvantaged because they don't understand much of their problems because of their less growth in their psychological capacities. When you look at a study that was done by Kamau et al. In 2017, they said that when a child starts suffering these illnesses, it takes them approximately averagely 16 months to actually get to a professional mental expert to help them. And so we're shouting out so that we get these children to come to us and be assessed and be assisted soon as possible so that we can also secure their future. These neurodevelopmental disorders, remember, they are targeting children. So it has to start in a child. It's a young brain, and that's why it's of a big concern. There are a variety of them. One of them is what we call intellectual disability. And this simply refers to challenges in mentation, things like reasoning, like working out solutions, learning, and there are different areas to it that we examine, but the point is there's a global problem of reasoning and learning for this child. So it will interfere with their academics, interferes with their social life, interferes with their even personal engagement. The other condition is what we call autism spectrum disorders. And this is also another array of illnesses that specifically interferes with a child's ability to communicate. So they don't know how to communicate to others or read other people's communication. It also interferes with their behaviors so that they seem to have repetitive behaviors that are not healthy, or they have interests or likings that are not exactly healthy, and so they have difficulties in socializing. The other category is what we call attention deficit and hyperactivity disorders, or ADHD, as most people know. And this specifically interferes with a child's attention or concentration on things. It interferes with their ability to sit still, so they just up and down. They seem to have this energy that they cannot contain. It interferes with their learning and memory, so they keep to forgetting things and they just can't wait on a line. They are not patient. So that's ADHD. We also have what we call motor disorders. These are basically interferences in muscle functioning. So they have these uncoordinated movements. So like tics or Tourette's disorder. So they just have involuntary movements around them. We also have what we call specific learning disorders. So this is different from the intellectual disability because this one is targeting only one area of learning. So you find a child is having challenges in just writing, or challenges only in the reading, or challenges only in the arithmetic. So that is called specific learning disorders. There are many others like conduct disorders and others, but these are primarily the neurodevelopmental disorders. A lot of the time, you can't tell what the problem is until they are assessed in different fields of life, at home, at school, and other social areas, so that we can confirm that this is specifically a neurodevelopmental disorder. So when you bring your child to us, Then we do that assessment, and we're able even to tell what is specifically causing it, because the cause could come from genetics, could come from infections that have affected them in that childhood, it could come from their relationships, the environment, sometimes it comes from their spiritual engagement, so many things. So we help you to narrow down to exactly what caused that problem. Once we've assessed, we work in a multidisciplinary team to help the child. It will include psychiatrists, psychologists, occupational therapists, social workers, and the rest as the child may need, so that we help this child get a true future. Thank you, and welcome to my body.